those of you who are trying to prevent dyskinesia, you've heard that maybe taking your levodopa medication can lead to dyskinesias. I have a lot of information for you. So they talked a lot about prevention, and one thing that they hit hard was the use of dopamine agonists. So if you are taking a true L-Dopa medication, like Sinemet, then that's an actual dopamine. That's actual, going in. But a dopamine agonist, an agonist just means that it's behaving the same way that dopamine would, but it's not really dopamine. So that's just some lingo in there. So you may have heard about continuous release L-Dopa. It doesn't look like, according to these studies, there's not benefit in the long run over 60 months to help prevent dyskinesia with the continuous release L-Dopa. There's nothing to link the prevention of dyskinesia to continuous release L-Dopa. Also, there has not been found to be any benefit from the use of COMT inhibitors. So if you guys are exploring COMT inhibitors, hoping that taking those will leave you less likely to develop dyskinesia. There's actually not a lot of benefit from doing it that way. Different dopamine agonists have been used, and they're usually favored in younger patients. Reduces dyskinesia and motor fluctuations, but you're also at a higher risk to develop impulse control disorders, somnolence, which is kind of that sleepiness, and sleep attacks. So I know a lot of my clients will say, yeah, I took my medication, my dopamine agonist, and I was just hit so hard with the desire to go to sleep. And I don't know what it is, and I hate it, but it does help to reduce my my dyskinesia quite a bit. And so there's this impact on your quality of life that you do need to consider as far as, just what's right for you. And I can't tell you what's right for you, only you know what's right for you, but work with your team to discuss it. Another way to prevent dyskinesia that they talked about were some non-dopaminergic approaches and emphasizing neuroprotection. So this is really where exercise comes in so important, and we're going to hit that home here in a second. But if you can exercise on the regular, I always preach 2.5 hours a week, at least, of vigorous exercise is what the research says. If you can do that and more, then you're having to take less medication over time. And because you're taking less levodopa over time, your likelihood for developing these dyskinesias and these side effects of the medications are far less. So I know exercise is hard. I know that it's uncomfortable, but if you know that by embracing that and doing that every day, you're actually preventing you're ensuring that your life is better tomorrow than it would be otherwise. So I know those of you who are tuning in, if you follow me pretty religiously, you're probably exercising, but tell a friend, share this with somebody who may not understand really why you exercise with Parkinson's. Maybe they really haven't internalized it. Help them understand, actually that's not fair, but give them the opportunity to learn about why exercise is so important, and it's not just, us physiotherapists getting, all excited about exercise for no reason. It really has one of the best ways to prevent worsening of symptoms in the long run.